like to talk about TMJ problems. TMJ is short for Temporomandibular joint, which is this joint here you can see on the side of our jaw. Okay, it's actually a very complicated joint. So the top part here is actually a curve, okay, and then the bottom part of our jaw is round. So when we open our mouth, in the opening phase, it actually rotates first. Then we have this thing we call translation, where the jaw kind of comes forward like that. Okay, so this side is your nose. You're gonna open, which is that rotation phase. Then as you open up big, you actually need to come forward a little bit. Okay, so on the skeleton here, you can see you will open, and then if I exaggerate it, it's gonna come out forward like that. Okay, so the most common issue is that people has complained of clicking in the jaw when they open or when they chew. Okay, if it becomes worse, you might actually have pain when you open or when you bite down. There are a few reasons for these. The more common one, I suppose, are just we call a alignment issue. So when you open, the jaw doesn't open in a direct line. The other cause of TMJ problem is associated with the disc. Now that is a lot more complicated. Basically, when we open our mouth, this piece of disc is actually in between the jaw and the curve down here. When we open up, you need to slide forward a little bit. And there's some ligaments that's tied to it. If you have laxity or injury to it, when you open your mouth, the disc actually might displace too much. It gets caught, so you might get like a lock or a big click. The most common problem has to do with the alignment when you open the jaw. So if I could show you on the skeleton here, the top teeth and the bottom teeth, the crack in between your front teeth, okay, so we call them incisors. If you put like a toothpick, a little piece on the front, on the top one, and also the bottom one, when you open, you could see them, the toothpick to line up. It's easier to see if you could go in a straight line or if it tracks. So you can see your teeth, when they open, if it starts to deviate, then you know you've got a problem there, okay? Before we start these jaw exercises, I want to make sure your posture is good. We talk about this in our other videos. Basically, you want to do a retraction. So the retraction is, I want you to bring your shoulder blade back, and then I want you to tuck back so that your jaw is in a straight line. You don't want to do them in this forward head posture, okay? And actually, the position of our back actually affects our jaw. As you slouch forward, we call this forward head posture, your jaw actually starts to shift. So that's something you don't want to. So we want to practice tracking of our opening and closing. So if you put your tongue at the back of your front teeth, that will limit how far you open. So as you open, never ever let your tongue come off your teeth. That means you open too wide. So make sure when you do these, you do them gently and slowly, okay? You don't want to go too fast. Going too fast might actually be bad. It's about the quality of the motion, not the quantity nor the speed. Okay, so if I use my fingers to represent here, so if I use these to represent your crack, okay, I want you to open them up and go in a straight line like this, okay, and come back. So make sure when you open, you don't drift to one side. Either side is no good. You're gonna do it almost like this speed, slowly open and slowly back, working on the quality of that motion. I would do about 10 repetitions. If you can do a couple sets in a day, the key is to train your body so when you open your mouth, they go in the proper tracking. The second one has to do with the deviation. So let's pretend when I open my mouth, let's say my jaw deviated to this side, okay? So what we're gonna do is, if we could build up the muscle on the opposite side of the jaw, it will pull it back, right? So if you take your hand and put it on your kind of chin part of here, okay? And I want you to start with the mouth just very slightly open, and you're going to push against it this way, and you're just gonna resist yourself like this. So the teeth, if you look at it, don't push it so that then your teeth would actually deviate. You wanna keep them in the middle, so when you push against it, you keep it in there. So that works on the isometric contraction of your jaw muscle, okay? So you could use your thumb or use your knuckle, whatever you want to do, just do gentle. And it's a very gentle push, okay? So we're gonna do them, first of all, with just mouth slightly open. I will push against it, let's say 5-second hold, do another 10 repetitions. And I will start doing with just slightly open. And as the week goes on, you could open your mouth a bit more to do them. So we're gonna do a bit more open and push, okay? Then go on for a week. Then you're gonna open it a bit more and try it. So the key is to gradually do these strengthening exercise with the mouth open more. And at the end, you could go hard open. But if you make sure you do it, you're gonna look into the mirror that your mouth is open there in a straight line, okay? You don't wanna do them when it's shifted. So if you build up this muscle, when that gets stronger when you open, you'll prevent it from deviating to that side, okay? So that's a good strengthening exercise. When you research about TMJ exercises, you likely came across something called Robacado 6x6 exercises. These exercises were designed by a physiotherapist by the name of Mariano Robacado. The 6x6 means there are 6 exercises and you do them 6 repetitions and 6 times a day. That may seem very extreme, but these are the frequency that you could do to help to train your joint. The first thing she wants to do is to find the resting position of your TMJ. So basically, she wants you to make sure your posture is good. You're gonna put the tongue at the back of your front teeth, and then I want you to breathe and gently. So you're gonna put it there and breathe. And from the side here, we're gonna make sure you're good. Number 2, she wants you to do the controlled opening, which was what we talked about, putting the tongue behind your teeth and open. So just make sure you do it like we said before. The third one, she talked about TMJ Stabilization. And these are kind of like the isometric exercises that we talk about, except she wants you to do a opening one. So you're gonna try to open your mouth, but resist it. Okay, so that's the direction. Then she actually does each side with the isometric exercises. I will still pay attention to which side you deviate and strengthen. If it deviates to this side, again, make sure you strengthen this opposite side more, okay? Then number 4, she talked about stabilized neck flexion. This is actually to stretch your neck. So she wants you to put your hand across your neck. I guess it stabilizes the neck. And then when you flex down, you could actually get a stretch of this area of the neck. We call them suboccipital. Because as we go forward this way in the forehead posture, these muscles might tighten. So you're gonna hold your neck and just do a nod and make sure you feel the stretch in the upper part of your neck. So number 5 is the neck retraction that we talked about. So if you retract your chin back, that's the direction. So number 6 is the shoulder retraction. Again, from the side view here, you're gonna bring it back. So those are the 6 exercises that she created.